Hello and welcome to our equine case conundrum. I'm Lucy Meehan, I'm your radiologist on call for this case. Our equine case conundrums are cases that maybe aren't all what they seem when you first look at the images, and cases that I've certainly learnt from as a radiologist, and I'd like to share some of that with you. So we're going to start with this week's case, which is a 6-year-old thoroughbred national hunt gelding who has been lame for about 8 weeks. He's grade 4 out of 5 lame on the left forelimb and hasn't improved to a period of rest. This horse was initially sent for nucleoscintigraphic evaluation, and I've just pulled out the most interesting images from that study. So this is a nucleoscintigraphic study. For those of you that aren't familiar with reading these, and certainly aren't familiar with reading them in this colour scheme, black is the highest concentration of radionuclide within the image, and white is the lowest, and everything else on a grayscale between. These images are on different grayscales, so left and right aren't on a comparable grayscale, but obviously the one where you've got both legs in the image, that's all the same grayscale. So if we start by looking at our left lateral image and comparing that to our right lateral image, we can see we've got quite a focal region of increased radiopharmaceutical uptake up here in the region of the proximal phalanx, and that's a very different pattern to that which we have in the right. If we compare the carpi left and right, you can see that the uptake in the right carpus is fairly similar in distribution and fairly similar in intensity to that in the fetlock, whereas if we look at the left, we can see that there's not very much uptake in the carpus there, and that's not because there isn't much uptake in the carpus, it's because the left proximal phalanx is doing what we call count stealing, so that's all the radioactivity is concentrated there, and that's taking all the black tones, and then there's fewer grey tones to spread over the rest of the image. If we then go and look at our dorsal image, we can see that we've again got this very marked area of increased radiopharmaceutical uptake in the proximal aspect of the proximal phalanx. This foot is slightly turned out, so it does appear to be slightly laterally placed, and I did spend a long time when I looked at these images first debating whether that was on midline and actually it was just the rotation of the foot that meant it was laterally placed, or whether it was actually within the lateral glenoid of the proximal phalanx. I concluded that it was proximal phalanx and on sagittal midline. However, we'll see when the radiographs come as to whether or not I was correct. So based on the scintigraphic images, I diagnosed this horse with a potential chronic incomplete proximal P1 fracture. We then went on to radiographs.